This guide is not a substitute for reading the FallSavers Connect mobility monitor instructions for setup and use. To reduce the risk of serious injury, the user must thoroughly read and understand the instructions for setup and use before using the FallSavers Connect mobility monitor. To begin, be sure your base unit is set up according to your preferences. If you are using the bed or chair sensor pads, be sure the PFM switch located in the battery compartment is set to the upper pad position. If you are using the floor sensor pad, be sure the PFM switch is set to the middle floor position. If you need assistance doing this, please refer to the base unit setup video. Once your base unit is set up, you need to insert a bed, chair or floor sensor connector into the sensor pad receptacle at the bottom of the FallSavers Connect base unit. Now hook the sensor cord into the cord strain relief bracket to the far right of the base unit. This is important to limit the strain being put on the sensor pad connector if the cable is pulled on. Next, check that the power source is working, indicated by the green monitor light flashing periodically. A few reminders. The magnetic cord assembly should not be used if sensor pads are connected to the FallSavers Connect monitor. Chair and floor sensor pads should not be bent, rolled or folded. The FallSavers foldable bed sensor pad can be folded along the central crease line for easy storage. Note the date that the sensor pad is put in use so it can be replaced when its designated life has expired. Finally, the weight of a patient impacts pad operation. If patients weigh less than 80 pounds, 5.7 stone, alarms may not sound. Place the bed sensor pad on top of the mattress horizontally across the width of the mattress just beneath the lower back, or chair sensor pad in the center of the seat. To test, apply and hold pressure on the sensor pad and release after a few seconds. An alarm should sound and the red alarm light should flash periodically on the front of the FallSavers Connect monitor. Press the hold button for 2 seconds to reset. You can now position the person you are monitoring in their bed or chair. When you place the patient on the pad, their buttock should be positioned over the top of the pad. Be sure that the sensor pad cord is not on top of or underneath the pad. If necessary, a sheet or towel can be placed over the pad, but additional layers may impact proper operation. Be sure to check the sensor pad cord and connector for signs of damage before use. When removing sensor pads, also be sure to press down on the connector clip that locks the connector in place prior to removal from the base unit. With any further questions, please call 0800 032 4789 or go to www.fallsavers.co.uk.